So thanks for everyone who has had the time to join us. My name is Kevin Welding. I'm the Associate Director of the Institute for Global Tobacco Control at Johns Hopkins Bloomberg School of Public Health. So thanks for joining us for our latest talk in the Innovations in Tobacco Control lecture series. I'm very excited to introduce our speakers for today, Rebekah Rodericks and Katherine Peck. Becky Rodericks is a public health evaluator, research faculty member, and principal investigator in the Office of Public Health Studies at the University of Hawaii at Manoa, where she has worked for over a decade. She holds a bachelor's degree in community health from Brown University and a master's of science in public health research from the University of Edinburgh in Scotland. Her work involves close collaboration with the Hawaii Department of Health and focuses primarily on the evaluation of programs that promote physical activity, nutrition, and of course, tobacco-free lifestyles to help reduce the risk of chronic diseases. Becky has served as PI for several tobacco and alcohol projects that have sought to reduce sale to minors. She also enjoys evaluating school health initiatives that address policy, systems, and environmental changes, and is currently collaborating with the Hawaii Department of Health to evaluate a 5-year CDC cooperative agreement aimed at supporting comprehensive tobacco control programs. Katie Peck is a research impact specialist at the Population Council based in Washington, D.C. She holds a bachelor's degree in health and societies from the University of Pennsylvania and a master's in public health specializing in health policy and management from the University of Hawaii at Manoa. Her current work focuses on providing technical input for a portfolio of dissemination and utilization activities designed to amplify the impact of the Population Council's social, behavioral, and biomedical research. Through diverse experiences in public health, Katie has cultivated critical skill sets in research, evaluation, policy, and program management that aim to create a more just world. So both speakers have a wealth of practice activities, and a recent publication in tobacco control is what motivated us to reach out to them. Today, they will talk about flavored tobacco product restrictions and bans, best practices for adoption, implementation, and enforcement. And we couldn't have picked a better time to be doing this. Given the recent announcements coming out of the White House just yesterday and the FDA earlier today about a possible menthol ban, this is very timely. If you'd like to ask questions, I'm going to remind you that there's a Q&A box at the bottom of your window, and I think that's all I need to do, so I'll hand it over to you, Becky and Katie.
Great. Thank you so much for having us. We're excited to be here, and we appreciate being invited to join you today. So we're excited to be able to talk about a policy evaluation project that we worked on related to flavored tobacco product restrictions and bans. So again, we'll be looking today at best practices for adoption, implementation, and enforcement. Next. So as you know, I'll be co-presenting with my colleague, Katie Peck. So she was the lead author on our paper. And thanks again to Kevin for the nice welcome and introduction. So we won't need to get into our backgrounds in any more detail at this point. Next. So here's a brief overview of the outline for today's presentation. So we're going to start with some background about tobacco legislation in Hawaii and an overview of our study. This will be followed by our methods and results, and this includes best practices. Then we'll discuss some recommendations and our dissemination approaches before ending with an update on the current legislative status in Hawaii, along with a discussion about the application of the results in a global context. And then finally, we'll open it up for some questions at the end. Next. Okay, so what we wanted to do was just start by showing you a 20-year timeline of smoking-related policies in Hawaii. So there are a lot of active partners and organizations that work together in our state to educate legislators and the community. There have been many achievements, both at the county and at the statewide level for legislation. So as a relatively small state of 1.4 million residents and one that is geographically remote from the mainland US, Hawaii has consistently passed innovative legislation to regulate and limit tobacco use across the last 2 decades. So this has led to an estimated total savings of $1 billion in healthcare costs for the state. And so I'll just point out a couple of examples here. So for example, in 2015, Hawaii was the first US state to raise the minimum age of sale, purchase, and possession of tobacco products to age 21. This included not only cigarettes, but also electronic smoking devices and other tobacco products. Also in 2015, state parks and beaches went smoke-free. As another example, in 2013, Hawaii banned the sale of electronic smoking devices to minors. And then by 2017, all 4 major counties had banned smoking in vehicles with children, and these bills applied to both cigarettes and electronic smoking devices. Next slide, please. So now that we've set the stage a little bit with smoking related legislation in Hawaii, we'll move specifically to our project on flavored tobacco policies. So as some brief background, our Healthy Hawaii Initiative evaluation team at the University of Hawaii is contracted out by the Hawaii Department of Health. So we serve as external evaluators for their chronic disease and health promotion for their programmatic work. And this was one of our recent evaluation projects. So as the overview, our project essentially was aimed to learn about the implementation process of flavored tobacco legislation in other states and jurisdictions. Just to provide a little context, we just wanted to make sure that we define what we mean when we say a flavor ban. So we're talking about a full comprehensive ban that prohibits the sale of flavored tobacco products. And this includes flavored e-cigarettes and menthol cigarettes. And as Kevin mentioned, this is definitely a very timely topic for this week with the announcement of committing to a ban on menthol. So we're very excited, and I'm sure there might be some discussion about that later. So the goal of our project was to identify key implementation and monitoring components to help inform legislative efforts in Hawaii. So what we did was we conducted key informant interviews to help us reach this goal. And so as you know, tobacco products are continuing to evolve, and there's been a huge increase in electronic smoking devices and e-cigarettes, particularly flavored. So we're starting to see this wave of states and cities and jurisdictions that are trying to ban flavored tobacco products from being sold. So we were just trying to inform the legislative efforts in Hawaii. That was kind of the initial goal of this project. Next. So we just like to share some of the methods with you that we did that we followed to conduct this project. So first we started with a review of the current literature. This helped us with several things. So we wanted to review existing legislation in this area so that we could see what policies have been successfully passed already. There's also a lot of great information about model policies and helpful language that already exists. And then we also wanted to gain familiarity with key terms, especially in a field where products are constantly evolving. So reviewing the literature also allowed us to identify people who are experienced in this area that we could potentially invite to be interviewed. So next, we created our interview guide once we had a better understanding of the latest policy directions and key topics. We reviewed the interview guide with partners just to make sure that everything was appropriate. We recognize that our area of expertise is more in public health evaluation and not as content experts in tobacco. So we wanted to make sure that we had reviewed it with those who were more familiar. Then next, once we had a completed interview guide and we had planned all the logistics for conducting the interview, we submitted our IRB application, and then the protocol was exempt, so we were ready to get started. So next. So just continuing a bit more with our methods. So Katie and I conducted the interviews between April and June 2019, and we conducted these by Zoom. All interviewees were located outside of Hawaii because our goal was really to learn from other jurisdictions that were already successful in passing similar legislation. So then we had a professional transcription service that was used to transcribe the content, and then we reviewed and cleaned the data. We then transferred the transcribed text from Word docs to Excel for data management and systematic coding. And then lastly, for analysis and summary, the text was aggregated by code to identify compelling quotations and meaningful themes. Interviews were deductively and inductively analyzed using the framework method. And so the framework method is a really useful approach for thematic analysis of semi-structured interviews, and it also supports the emergence of new and additional themes as well. Next slide, please. So our interview guide had about 8 to 10 questions with various prompts as needed. And this is included as a supplement in our paper for those who are interested in more details on this. But here are a few of the overarching topics, just to give you a sense of what we discussed related to flavor bans. So we just wanted to know what was involved in the implementation process. We also wanted to know more about how a flavored tobacco ban is enforced. We were also curious to know if jurisdictions were actually evaluating their implementation process. And then we wanted to have a better understanding of how effective these flavor ban policies actually were. And then ultimately, we were looking for any lessons learned that could be useful for Hawaii. So at this point, I'm going to pass it over to Katie, who is going to jump in and share some of our results with you.
So thanks so much, Becky. And so as Becky mentioned, we collaborated pretty closely with the Hawaii Department of Health in designing this project, and they really were helpful in providing some names of potential experts for us to reach out to. We ended up interviewing 17 participants in total. 8 worked with public health departments, 4 had legal backgrounds, 4 were university researchers, 2 held positions in local government, and 1 was a researcher in an academic setting. And I'll also note that several of the individuals we spoke with as pretty renowned persons in this space held multiple appointments. And so in the process of coding the data, we ended up categorizing results into 4 overarching themes: program planning and legislative preparations, education and community engagement, implementation and enforcement of flavored policies, and understanding policy impacts. So moving into some of our key results, I'll start first with program planning and legislative preparations. And I'll note that while initially our study was really meant to focus on implementation and enforcement, the folks we spoke with really didn't dissociate policy passage or adoption of a policy from implementation processes. And it was widely recognized that erecting a really strong policy was seen as essential to laying the groundwork for successful implementation. So among the top reflections from the participants was the value of comprehensive bans to promoting public health and health equity. Partial bans, ones that only restricted particular types of products or focused on specific geographies, we learned had been really complicated and challenging to enforce, and had often even required additional legislative efforts to remediate or correct unintended consequences. And as has been referenced already, this next point on menthol feels especially timely in light of the FDA's recent announcement. So menthol was of major interest in our conversations, as historically it's been excluded from flavored bans due to its popularity among adult tobacco users, making it particularly economically lucrative. And it was mentioned by many of the individuals we spoke with that in order for a flavored tobacco ban to be truly equitable in nature, it could not exclude menthol, which, as we know, has been aggressively marketed to Black, Indigenous, and communities of color, as well as young people and other marginalized populations for decades by the tobacco industry in the United States and elsewhere. Several experts also noted that they would likely withhold support of a proposed policy that exempted menthol. And as we see these same references to addressing health disparities in the FDA's recent rationale for building on their 2009 flavored ban on cigarettes. So recognizing this is a complex issue in which the tobacco industry and many others have a vested interest, participants were pretty proactive in providing suggestions to keep in mind in the process of drafting and proposing bills. So several interviewees mentioned the importance of including specific and comprehensive language to avoid potential loopholes, as well as proactively identifying responsible actors and granting them necessary statutory authority so that the law could be successfully implemented and enforced as intended. And then finally, regarding some of the economic and financial considerations, it was pretty widely recognized that policymakers are often quite concerned about the anticipated reductions in revenues associated with loss of tobacco sales in the context of a flavor ban. And so to address this challenge, several interviewees mentioned the importance of longer-term strategic messaging campaigns around the economic impacts associated with tobacco regulation. And in the long term, the real need to find alternative sources of government funding that are not reliant on the public participating in unhealthy behaviors. And it was mentioned that these messages can include data points on projected public savings that come with tobacco cessation and preventing future generations of tobacco users. And so here we just included an illustrative quote reinforcing the importance of pushing for really thorough policies. So one expert shared, "My biggest personal takeaway for any tobacco policy is when it comes to a new bill or law that goes through, once it's passed, people will adjust. That's why I'm really trying to push to make it as strong as possible, because if it passes, if it goes through, they'll adjust. Everyone will get used to it, everything will be fine." So while perhaps a bit of an oversimplification, this again reinforces a common perspective we encountered surrounding the value of comprehensive policies, which, while perhaps harder and more time intensive to pass, are ultimately easier to implement and enforce. So next, in the context of education and community engagement, media campaigns were identified as a really critical avenue for building awareness and support of flavored tobacco policy changes. It was recommended that these campaigns focus both on flavors as well as menthol to highlight exploitation of communities of color and marginalized populations. It was also noted that these campaigns must be accompanied by well-funded cessation services, and that it would be inappropriate and unethical to push for a ban or restriction without providing people the tools they need to quit. It was also strongly reinforced in our conversations that retailers should be considered partners, not enemies, in this effort. It was widely acknowledged by our interviewees that people generally want to be compliant with the law, but they really need support and guidance to do so, particularly with a complex issue such as a flavored tobacco ban. It was also anticipated that there would be initial pushback from the retailer community for fear of economic losses, but this could be overcome with individual level engagement and problem solving. And so the role of community partners was also a very strong theme that emerged from our conversations. It was widely acknowledged that community partners should be central to all phases of the policy implementation and enforcement processes. And in Hawaii specifically, Native Hawaiians, Pacific Islanders, and Filipino leadership were seen as really critical, given that these communities have been targeted by the tobacco industry and use menthol products at much higher rates compared to other populations. It was also recognized that engaging youth, particularly in testimony and public hearings, can be an impactful strategy for reaching legislators. And other key actors identified in this context included law enforcement, the military, the tourism industry, as well as religious groups. And here we've included an illustrative quote reinforcing the importance of retailer engagement. So one expert shared, "Based on our experience, the retailer engagement is absolutely key. They're hopefully partners in this effort and not just people to be regulated. In our experience, most retailers genuinely want to comply with the policies." And retailer education and partnership, which I'll continue to discuss further in our next results section, emerged as arguably the single most foundational element of successful implementation. So here is really where I will dive into the finer details of implementation and enforcement. And I want to preface by recognizing that these suggestions, like all of our findings, were made in hindsight in the context of an ideal scenario. And as for many complex issues, implementation and enforcement of flavored tobacco policies emerged as a highly resource-intensive process. And unsurprisingly, successful implementation appears highly dependent on sufficient funding and personnel. but I'll start first with the timeline. So it was shared that ideally this type of policy should be rolled out in a 3 to 12 month timeframe, acknowledging that pushing too quickly could leave retailers, communities, and enforcement agents unprepared, yet waiting too long could work to undercut momentum and public interest. I'll note that the suggested timeframe was recommended for a more localized policy operating at a city or county level, and that a state or federal level ban, which would be more complex and require more robust coordination, would of course impact considerations around timing. Within this, participants widely acknowledged that grace periods before full application of the law were critical for education, permitting retailers to sell down their flavored product inventories and allowing for enforcement agents to conduct warning visits in a more friendly atmosphere. And again, retailer education was widely identified as the key step of implementation, alongside continued advertisement of public health cessation programs, or rather tobacco cessation programs. It was emphasized that knowing that a jurisdiction knowing their retailer population well was really important in creating effective and appropriate notification as well as educational materials. And individual level outreach to retailers was by far seen as the most effective avenue for engagement, though this hands-on approach oftentimes warranted extra manpower, in some cases involving the support of trained volunteers. It was also acknowledged that vendors and distributors could serve as other impactful avenues for reaching and influencing the retailer population. In terms of responsible agents, we saw no kind of single approach across all of these jurisdictions. Many involved departments of health or public health agencies, some law enforcement, and others a combination of both. In most instances, it was a matter of simply assessing kind of the capacity of different institutions and identifying who was best positioned to implement and enforce. So in terms of enforcement procedures, there were a lot of details provided to us by the interviewees, but I'll just highlight one common theme, which was the importance of licensing agents as providing kind of a baseline in both identifying the retailer population for education and implementation purposes. And regarding compliance, it was pretty resoundingly recognized that use of fines alone are not an effective deterrent for retailers who could stand to recoup lost income fairly quickly. And it was unanimously encouraged that Hawaii consider a combination of fines and suspensions targeting retailers, not users, especially not youth. And finally, an interesting theme that emerged over the course of our discussions was the role of concept flavors, these flavored tobacco products that are not easily identifiable as fruit, dessert, or menthol. And so the ever-growing flavor options, especially for e-liquids, have made tracking and identifying products difficult, even for professionals who are well-versed in this space. However, several jurisdictions cautioned that in their attempts to kind of create comprehensive lists of banned products, these lists were nearly impossible to maintain as the number of products have continued to proliferate into the tens of thousands. And so an alternative suggestion that we heard in our conversations was to create a list of non-flavored products as opposed to maintaining these large lists of banned products. So this recommendation, generally speaking, would entail developing a certification, approval, and appeals process. And for example, manufacturers would certify under oath with a penalty for making a false statement that their products do not contain characterizing flavors, and then the designated enforcement agency would be responsible for product review and approval. So while not yet attempted at the time of our conversations, a non-flavored product list would put the onus more on industry to prove that their products are not flavored, hopefully reducing work for public enforcement agents. And so finally, we turn to some of the themes related to policy impact. So many cautioned in our conversations that it was really important to start thinking about evaluation even as a policy was being conceptualized. so that appropriate baseline data could be collected to demonstrate impact post-passage. Our interviewees had a lot of ideas to share about how to best evaluate a flavored tobacco ban, highlighting the importance of disaggregated data, as well as suggesting a range of indicators and data sources. And so while it was clear that there was still a lot of room to grow on this front, still experts widely perceived that flavored tobacco policies in their jurisdictions had been pretty successful, citing high compliance and retailer cooperation. They also routinely referred to point of sales data demonstrating that sales of flavored products had fallen after policy implementation. And it's also clear to us that over time, these policies have grown increasingly comprehensive in scope as experts are learning from one another and building off of momentum in other jurisdictions. And so finally, another indicator, I'll use that in quotes, of success was the relative omnipresence of industry lawsuits targeting flavored tobacco bans. So in virtually every conversation we had, we heard about how past and pending litigation threatened to undo flavored tobacco legislation. And many saw this highly coordinated and well-funded threat as proof that these types of policies were really getting at the heart of the industry's market. And so here's a final illustrative quote reinforcing how pervasive industry pushback has been and how interference at local levels can really hamper state level action. So one expert shared, "We really couldn't go to the state level because we needed to start with the cities and towns and then go up. The industry has such a big presence in our state house. I just would never undermine that. They are everywhere. Really, they have the legislators' ears and they are the small businesses in all of these cities and towns and counties. It was very hard to counter that." So from the many points I covered, we attempted to distill 10 core recommendations related to a flavored tobacco policy in Hawaii. And these are color-coded corresponding to the 4 themes that I just walked through. And so on the policy front, we emphasize the importance of precise and comprehensive language, the inclusion of menthol in any flavored ban, and the importance of predetermining and authorizing roles for enforcement. Regarding community engagement, we highlight the importance of involving a variety of actors, developing targeted media campaigns, and creating accessible educational materials to assist with the notification process. Related to enforcement, we recommend establishing a grace period to enable extended retailer engagement and education, focusing penalties on retailers, not users, and exploring the possibility of developing a non-flavored product list. And finally, last but not least, we've reinforced the value of collecting baseline data and predetermining key indicators to assist with policy and impact evaluations. So to ensure that these findings were shared with the right audiences, we advanced a variety of dissemination activities. First and foremost, our biggest priority was sharing back our results with our key stakeholders, including the Department of Health, partners such as the Hawai'i Public Health Institute, and the experts who had so graciously shared their time with us in these conversations. So we prioritized sharing a snapshot of highlights with the Department of Health to support their strategic planning efforts, which was followed by conversations to discuss findings in more depth. And then we went ahead and provided an executive summary of findings to all of our interviewees. And as Becky mentioned, we started by conducting this study to inform efforts in Hawaii, but we also realized that this would be of relevance and interest to legislative efforts in the US and beyond. So in attempting to reach a wider audience and address a gap in the literature that we had identified, as mentioned, we published these findings in a journal article, and we continue to engage in conversations and dialogues such as this webinar. And finally, to ensure these findings could be utilized locally by other stakeholders, we continue to circulate this information with our partners to support preparation for legislative hearings and program planning purposes. And knowing this project was very closely tied to the legislative and programmatic context in Hawaii, we wanted to just give a little more information about the status of flavored tobacco policies and how the context is illustrative of some of the themes from our study. And so, as we all know, flavored tobacco bans have gained a lot of momentum in these past few years. A variety of stakeholders across Hawaii have been working to advance this issue since 2014, first starting with attempts to ban flavored products at the county level. And a major date I'll note is that in 2018, preemption was actually introduced through an unexpected last-minute replacement bill at the end of our state's legislative session. And this ended up prohibiting counties from proposing ordinances related to tobacco sales, which included a ban on the sale of flavored products. So this unfortunate reminder of the presence of industry interests led to a more robust push for a state-level ban. And so in 2019, the Campaign for Tobacco-Free Kids provided support to Hawaii to mount a coordinated policy and media campaign on Flavors Hook Kids. There was really close coordination with our local coalition as well as other stakeholders who led efforts to engage youth and community members in testimony and public events. This became a very visible issue. And unfortunately, despite this momentum, attempts from legislators to pass a policy excluding menthol created a very contentious situation. And so a flavor ban was not passed. And probably the closest the state has come on this issue was in 2020, but unsurprisingly, the emergence of the COVID-19 pandemic disrupted the legislative session and reoriented public health and economic priorities for the state, as in many other contexts. And most recently in 2021, our legislative session is just winding down, and despite the introduction of several flavor ban bills, only 2 were heard and both were subsequently deferred. And again, the conversation about flavors was stymied by larger concerns with economic hardships brought by the pandemic, which really reinforces the importance of being able to speak to the longer-term financial impacts of tobacco policies. So to summarize, there are several continued challenges of relevance to our findings as coalition members and statewide partners have been fighting for several legislative cycles to keep menthol included in the flavored tobacco ban. And they've also been working hard to avoid inclusion of user and youth penalties, which have been repeatedly invoked by legislators as well as other interest groups as enforcement mechanisms to curb use of e-products, particularly in school settings. But despite all these challenges, we remain really heartened by the dedicated partners in our state who are really determined and passionate about this work, including a very active youth council who are keeping the momentum going on this issue. And now I will turn things back over to Becky to highlight some global applications of our study and wrap up our presentation.
Great, thanks so much, Katie. So yes, for the last portion of the presentation, we wanted to raise some potential discussion points about the global context and in particular low and middle income countries. So we'll start by reflecting on flavors and marketing first. So given that the regulatory and policy environments are shifting in high income countries, the tobacco industry has refocused on new markets. So today, nearly 80% of the world's 1 billion smokers now live in low and middle income countries. This population is exposed to strategic tobacco marketing. Exploitation and deceptive marketing practices targeting Black and Native populations in the United States are also applied at scale in these contexts, which have even less capacity for regulation and enforcement. So as some countries are already struggling with a double burden of disease, dividing attention and resources between communicable diseases and non-communicable diseases, they're also facing an aggressive and proliferating presence of flavored and unflavored tobacco options, including e-products. So there has been a global increase in flavored tobacco marketing. In many lower income countries, plain packaging for flavors is typically not part of tobacco control measures. Furthermore, many countries seem to have weak health warnings or no warnings at all on tobacco packs. And then also, while there may be some variation in the definition of what constitutes flavors, concept flavors have emerged as a common challenge across countries and regions. So these ambiguous flavors and product names make it difficult to determine when a tobacco product qualifies as a flavored tobacco product, thus making enforcement quite challenging. Next slide, please. So a recent study conducted in 2019 sought to identify countries that passed tobacco flavor policies. The results showed that 11 countries and the European Union currently ban or restrict tobacco product flavors. So as we can see, the vast Majority of countries with some sort of flavored tobacco ban are in the global north, though Brazil, Ethiopia, Uganda, Niger, Mauritania, and Senegal are exemptions. So the majority of existing flavor policies, though, they focus on traditional tobacco, such as cigarettes, and did not explicitly prohibit flavors in e-cigarettes. So there are also some similarities that were noted across countries, and that also resonate with the findings from our study. So I'll just talk about a few of these briefly. So the menthol exclusion and exemptions were found to vary in national and regional policies, which is similar to what we were seeing in different policies in US cities and states. A focus on youth and a focus on promoting public health were often cited as justification and the rationale for prohibiting flavors. Some common barriers include the need for implementation guidance due to the complexities of implementation and enforcement. Other barriers include economic incentives and legal challenges from the industry. So for example, Brazil became the first country in the world to ban the use of flavors and additives in tobacco products, including menthol in 2012. However, implementation of this regulation has faced lengthy court proceedings over many years because it was challenged by industry groups. So these legal tactics are employed by major tobacco industry companies to delay the implementation of a ban and are part of a global pattern of litigation and intimidation tactics to delay or block policy. Preemption is another area of legal concern that is applicable across countries. While it seems that most flavor policies do not have preemption clauses, anti-preemption language hasn't really been used either. So this language would be recommended so that laws are not susceptible to challenges from the tobacco industry. Next slide. So for resource-limited countries who are thinking about implementing a potential flavor ban, here are a few additional considerations. So first of all, the lack of clarity and uniformity regarding key terms is pervasive. So for example, characterizing flavors and concept flavors. Bans that prohibit additive or ingredient compounds may be challenging for enforcement, especially in low and middle income countries, where they may not have the technical staff expertise, or they might lack sophisticated lab facilities and equipment. Different regulatory environments may also complicate implementation of flavored tobacco policies. So for example, many retailers may sell individual cigarettes rather than packs of cigarettes. Also, street vendors may be harder to monitor. Graphic health warnings on packaging and taxation might not be as successful under some of these regulatory conditions. Other challenges related to limited resources involve implementation and enforcement, which is already challenging even in high-income countries. So for example, having enough staff and resources to conduct compliance checks with retailers at stores. We heard in some settings in the US that health authorities relied on trained volunteers. And then in addition, legal proceedings should also be anticipated for flavor policies, but legal representation against big tobacco just might not be an option for resource-limited countries. And then also additional considerations related to limited resources involve allocating new expenses to meet the requirements of the new flavor ban, but also maintaining essential tobacco control programs such as cessation services. So this continually came up in our study as a reminder that cessation services are critical to simultaneously promote alongside any ban. So maintaining these fundamental services and sources of funds is not only a challenge in lower income countries, but is also an issue for higher income countries too. Next slide, please. So even though the original intention of our project, this wasn't the original intention of our project, applications and recommendations from our study, along with other in-depth case studies, seem applicable in a broader global context. We know that there's not a one-size-fits-all solution here, and we know that we should anticipate that adaptations will be needed regarding some recommendations for policy implementation to fit the needs and capacity of a particular context. So in the US, we recognize that state level action often precedes federal policy change. So we also encourage localized exploration of successes and challenges to contextualize the national efforts. For our study, we didn't consider regulatory elements since we weren't looking at the federal level, but we do know that packaging and labeling requirements at the federal level can also be effective deterrents. And while it's clear that comprehensive bans are optimal to strive for, the reason for this is because this can reduce confusion in policy interpretation, avoid potential loopholes, and promote the best possibility for successful implementation. So comprehensive bans are especially important if considering country level or regional policies. Comprehensive bans are especially important, I guess, even in very localized jurisdictions. We've seen how economic interests drive retailers to exploit loopholes in the context of partial bans. So partial bans can create an opportunity for new products or methods to be introduced. So kind of finally, we know in our research, we found that other jurisdictions and experts were very willing to share their lessons learned and to help ease the process for other jurisdictions, which we really appreciated. We know there's an active global tobacco control community who is eager to partner together. So we encourage everyone to kind of learn from one another, share challenges, whether they were anticipated or not, in order to push back against the tobacco industry. And so in highlighting these best practices, as well as common challenges, we hope to be able to contribute to successful adoption and implementation and evaluation of flavored tobacco policies that demonstrate their long-term impacts on public health. I think to wrap up, next slide, please. Yeah, we would just like to acknowledge those that have contributed to this project. So our co-authors and collaborators, we have several who are on the call with us today. So we wanted to thank the Hawaii Department of Health, the Chronic Disease Prevention and Health Promotion Division, as well as Hawaii Public Health Institute for providing meaningful insights while we were working on the development of the interview guide and also helping with the data interpretation phase. Also to the tobacco experts, so those that participated in our interviews, we really want to convey our thanks and appreciation to all the key informants who took the time to participate in the study and share their valuable expertise with us and share the lessons learned from other states and jurisdictions. And then lastly, we just wanted to mention that this project was funded by the Department of Health through a contract with the University of Hawaii's Office of Public Health Studies and the Healthy Hawaii Initiative evaluation team. Next. So I believe the next slide, we just have our contact details here for Katie and myself. We just wanted to share this with you. We welcome you to reach out to us after this presentation. If you have any questions or want to have any further discussion, we're happy to talk more about this. I think next we've got one more slide, which is just our Q&A. And so we're just excited that we also have several of our Hawaii colleagues on the call. And our co-authors with us. So we welcome them to contribute to any further discussion to help address any of the questions you may have. So I think we have Jessica, Jill, and Lila, and Katherine on the call with us today, I believe. So again, thank you as well for all of your help with this project. And we welcome their expertise. So please feel free to join in the discussion portion. Thank you very much.
Okay, thank you. That was a great presentation, and like we said, it's super timely. We've gotten a few questions that have come in, and you might be able to see them, you might not, but I will read them. And I'm also going to take the moderator's prerogative and throw in some of my own questions. And if we have time, I have sort of very broad questions, but I have a couple of specific to your research questions that you might be able to answer. The first is, did you guys see any patterns that, like the highlighted themes that you have by participant type? Obviously, like, legal is very different from some of the researchers. So yeah, when you went through these interviews, did any real differences come out by the participant type?
Trying to think. I don't think offhand we noticed any particular themes by participant. I do certainly know that the legal folks we spoke to were very specific about warning us about language that should be used or avoided, which of course was very helpful, as well as making sure we were thinking about it was like the data standards practices as well, and things like that. So there was some kind of guidance from the legal folks that were very specific but I felt in general, whether it was researchers or coming from a Department of Health, that in general, they seem to have a lot of shared themes and experiences. Yeah, in that sense, I don't think we noticed anything. But Katie, I'm not sure if there was anything else you thought of. Yeah.
Yeah, no, I was just going to say, I think it's more people's respective positions allowed them to speak more specifically to the different types of questions that we pose. So the health department and local government officials could really get into the nitty gritty of implementation and enforcement procedures, whereas Becky mentioned the legal folks have a really good handle on kind of what the policy standards and the model language should be, whereas maybe some of the research folks were more interested in kind of predetermining of some of those evaluation indicators, thinking more proactively about the impact piece. So I think also because many folks wore multiple hats, they were able to bring, you know, different parts of their careers to bear in the discussion. But yes, I think generally it was more about what folks could tap into with the greatest level of specificity.
And so my other question was about, like often, obviously your recommendation is to not have any exemptions, but often a menthol exemption, it sort of surfaces. And you highlighted that having community partners, especially in priority populations, is important. So like, do we need to do more of that community partners in those priority populations that are affected or would be, you know, have the greatest benefits of a menthol ban while going through this process?
Yes, absolutely. That was something that came up quite frequently is make sure that there is, you know, strong community engagement, make sure that you are working directly with the priority populations that are going to benefit or be impacted the most. And particularly it was, you know, if you're working on regulations for a priority population, how can they not be involved in the process with you as key partners? And so that was something that was definitely a broad recommendation that from early on, you know, build these partnerships, find out what any concerns are, work together. And so it was thought that we're not doing enough in this area. And that was something that does need to be, you know, strengthened more with community partners and just really the importance of that. So yes, we would agree with that. Mm-hmm.
Yeah, and I'll also add that, like as you mentioned, menthol exemptions often surface in conversation, and as well as almost kind of the weaponization of priority populations by industry. We've seen in particular contexts allegations from, you know, identified community leaders that menthol bans are racist just due to the lack of education around kind of the real intent. And understandably, as populations that are facing a lot of challenges, perhaps even in accessing, you know, necessary and regular treatment and cessation services, it's really important, yeah, to have the movement come from the community as opposed to it appearing as kind of an externally imposed policy for it to really lay the groundwork for success.
Thanks. Okay, so there's a couple of questions that are about retailers, and I'm going to sort of combine them together. And obviously, you made a point about retailers as sort of partners, and that being very important. So the one was any insights from, I don't think you had interviews with retailers, but maybe in your interviews, did you have any sort of, you know, secondary information about dealing with retailers and how the tobacco industry sort of coaches them post flavor bans on new or altered products? And the other one is slightly different. It's, I think, thinking, you know, about the e-cigarette vendor as well, a very different type of vendor, right? Only because with the traditional cigarettes, they're often selling many things. Sometimes in low and middle income countries, you do see small vendors only selling cigarettes, but inside the US, you see them selling a lot of other things. That would not be the case with most like vape shops, right? That's their only product that they're selling. So yeah, anyone had experience bringing up vape shop owners on board, and any recommendations for this if flavor bans included e-cigarettes?
Sure, I can start with a couple points relating more to coaching retailers. And so, yeah, this was really a very strong theme that came up, was to really be working closely with retailers. And so some of it seemed like very common sense stuff, but was still came across as really important for retailer engagement. So For example, whether it was volunteers or health department workers who were working with retailers after the ban was going into effect or during the grace period for implementation, was really to have, make sure you're having direct contact with the retailers. And they felt that even if it was a volunteer staff who didn't know the answer to questions immediately, if there was a direct communication for them to, be able to contact the person, they just felt having kind of direct access to someone to, send their questions to, was something that they felt that they were kind of being looked after, that there was someone that they could, reach out to. We also found that texting was something that retailers in many areas wanted to be able to do, like text with whether it's Department of Health staff or whoever was the contact. They wanted to be able to send, quick messages. They were actually excited to say that they were in compliance, right? They wanted to be able to share that news and be like, so that was one method that worked well with some retailers, was texting. Maybe they're, not dealing with computers as much, but texting was more of a common form. And then equally for staff to be engaged by, not just sending warning letters, but to actually spotlight the retailers that are doing great things, that are in compliance. So again, bringing recognition to the positive things that are being done. We also heard, as far as kind of coaching, was that, there were some retailers that were worried about if they stopped selling these flavored tobacco products, are they going to lose out on some of their business? And so while this actually didn't seem to be as big of an issue when we spoke with folks, so where policies had passed, it was still a concern of retailers. And so there were a lot of people that kind of worked with retailers to try to help them figure out what else might you be able to sell as a replacement? Are there other things? So some worked on selling healthy food products. Are there other things that you can do? So there were kind of all kinds of creative ways and different things based on the needs of the retailers. So we found, a lot of people to be quite responsive in working with the retailers. Okay, I'm not sure if you have anything more on the vaping piece that you could elaborate on.
Yeah, I can kind of jump in on the second question related to retailers. And so I think, Kevin, as you identified, kind of differentiating between traditional cigarette retailers as opposed to vape shops is really important, as kind of vape shops and adult tobacco stores have a really kind of unique stake in these policies, as their revenue is almost completely reliant on e-cigarettes and flavored products. And as we saw in Hawaii and other places, they're often among the most singularly vocal critics of these bans, as they routinely make arguments that they lose to stand their entire business and livelihood. And so at the time that we were conducting our study, I think the point of policy passage was, the focus was much more in our conversations about engaging traditional retailers in negotiating alternatives, as opposed to addressing the concerns of vape shops. So I feel like that would be a very interesting piece to kind of hone in on now 2 years since our conversations, to learn more about that particular context. But we also recognize kind of that this is where it's really important for kind of proactive government support and incentives to support businesses if they're being asked to kind of shift away from their principal livelihood.
Great. So another question from the audience that I sort of have a similar thing on. I mean, Hawaii is a sort of a tobacco control leader in the United States. And my question was kind of like, why? What sort of is unique about Hawaii? And the question from the audience is, can the speakers discuss policy development implementation generally in Hawaii? Are there unique challenges across the different islands? Is public health community coordinated across the state? So I think, there are certainly challenges to doing policy in sort of an island state, if you want to say a multiple island state as well. But yeah, Hawaii has done pretty well in terms of tobacco control. So my broader question, is it great researchers like yourselves? Is it strong legislators or champions? Or is it the fact that it is this like sort of smaller state that is isolated from the rest of the country that plays a part? Or just, lots of places that have a general health and wellness sort of focus also do well with sort of NCD type policies. So yeah, anything you can say about the Hawaii specific situation?
Katie, do you have anything offhand? Otherwise, this might be a good opportunity for us to actually, we've got some great experts on the phone who could answer this probably in better detail than we can. So if either, if Jessica, if you'd like to jump in, and she's got a lot of information to share about our coalitions as well, but we'd be happy to have you share, or Lila or Jill as well, but thank you. Sorry to put you on the spot.
No, thank you. This is Jessica. They gave me the opportunity to unmute, so thank you. So it's a difficult question because things haven't been as easy as of late, and things have really changed. But I think what I would say, it is a comprehensive effort, and I think when you have the political will, which does occur at times, you have to be ready to take advantage of that opportunity. You have to have the research, you have to have the community, you have to have the model language. And the stars aligned for us when in 2015, when we passed Tobacco 21, and we were the first state to do so. And now, to think not too many years later that we actually had it at a federal level was not something we ever thought. One of the advantages for our state, though, I think too, is that we don't have that same argument of you can drive across state lines or you can drive across the county and be able to still purchase these products, right? We are an island state. You have to ship everything in. And so that's an argument that we never have to really contend with. So that has been helpful. But I think our biggest thing, it is so much easier for bills to die than to pass bills, and you just have to be ready when those stars align, and to have all your systems in place and all the research, and be ready, because the hard questions do still come even when the stars aligned. But they're all the pieces, the community pieces, the research, the data, and we have so many awesome partners that we rely on too. And National Resources Public Health Law Center has been instrumental in helping. We work closely with Campaign for Tobacco-Free Kids, and there's having that type of those types of resources are really critical too.
I don't know if any of our other additional guests wanted to say anything.
This is Lila Johnson, Department of Health. Just one comment to add to what Jessica offered is the strength of our communities. We have strong coalitions on our neighbor islands, and the wealth of energy comes from the community. And we have been able to enact over the years legislation at the county level, and then be able to move it up to the state level, so it's more consistent and covers around. Because the person who asked the question wanted to know about the coordination, and the coordination is actually very good. We speak, even though we are separated by water, we have very close communication, and we listen to our communities for our strength.
This is Jill. I don't have anything to add. I think what Lila and Jess shared was spot on. It is neat to see our counties trailblaze and take the lead on a lot of these groundbreaking initiatives, and then we see it sort of catch fire. And so yeah, we've seen a lot of success that way.
Well, thanks. So I think this is a great place to actually wrap up right here. There are other questions, but I'm sure people could reach out directly to Becky and Katie for things of like what type of future research they're going to be doing. And just again, kudos to the team. And obviously it is a team effort. You can see everybody up on this screen now. So yeah, thank you for this presentation. It was great. Thank you for everybody who joined us today. And yeah, let's keep our eyes out for that FDA menthol ban at a federal level moving forward. So thanks, everybody.